If these walls could talk, they'd tell stories of lives saved, dreams restored, shattered bodies made whole again. Aurora BayCare Medical Center was built focusing on revolutionary concepts in patient care, a historic partnership in community care, and a future built on quality. Here's our story. Turn the clock back a decade. In Green Bay, a group of physicians had a radical vision of patient-centered care, a hospital where physicians joined administrators in decision-making. The future had its roots in the fields of East Green Bay and in a unique relationship.
From the very beginning, the architecture of the hospital was designed to be more patient-friendly, more home-like atmosphere or hotel-like than hospital-like.
And so we really believed that there was still a market out there for a business proposition, that physicians that were dedicated to quality and dedicated to service and dedicated to a unique experience with the patient, that there was still a need for that.
In 2000, Aurora Healthcare and BayCare Clinic formed one of the most revolutionary partnerships, combining the region's leading network of primary care clinics with Northeast Wisconsin's largest physician-owned specialty care clinic.
BayCare Clinic is a strong specialty medicine group. Aurora Medical Group at the time was a strong primary care medical group and had some medical specialties as well. And so we needed each other in that regard.
We really become kind of a one-stop shop, all the way from our primary care physicians up through the specialists who are employed at BayCare Clinic, right to the services that are offered at the hospital.
From the beginning, the facility incorporated revolutionary design elements to focus on patient comfort. Seating areas replaced sterile hallways. Details like natural light, aromatherapy, noise abatement, and music contributed to patient healing. When it opened, hospital rooms and maternity suites were uniquely designed to give our new mothers the most comfortable patient experience possible.
We have the most deliveries in the city of Green Bay. It's a very busy unit. We do about 140 to 150 deliveries a month, which is exciting. It's a great place to work.
Staying with my mom.
Staying with me the whole time.
Yeah.
From the moment she was born to the day that we left, she was with me.
The Women's Center consolidated family planning and healthcare services. Services include maternity, a neonatal intensive care unit, and the only full on-site fertility program in Northeast Wisconsin. Our comprehensive breast center is the first in Wisconsin accredited by the National Accreditation Program for Breast Centers and only one of 4 in the nation so named.
We're a top 50 heart hospital in Wisconsin, and we take great pride in that because we're the only one in Wisconsin on that list. And it's really easy to provide care when you have that kind of confidence and pride.
We were the first in the area to create an integrated approach to heart, lung, and vascular care. One of our first patients who needed that care had 5 cardiac bypasses.
I can't say enough. In my eyes, they actually saved my life. They were absolutely wonderful.
Family members could be minutes from her side while staying at our hotel rooms located right at the hospital. The NeuroCare Brain and Spine Center provides access to a team specializing in trauma, spine, brain, and pain management care, all backed by state-of-the-art diagnostics and imaging. In 2005, a new deep brain stimulation procedure stopped one woman's tremors. As she says, doctors gave her life back to her.
Because where would I be if I didn't have it done? I would recommend it to anybody.
In the decade Aurora BayCare has been open, more than 20,000 regional residents have come to us for cancer care. We treat more cancer patients than any other state health system.
Our cancer care team provides a unique approach to cancer care where we put the patient at the center of their experience. We give them one appointment where they can sit down and meet with all of their providers. I truly believe this is the best for the patients, and I'm passionate about working at Aurora because everyone here likes to see that patient and that family satisfied with the care we provide.
He made me feel so comfortable and so at ease. We're here to save your life. We're here to give you quality of life, and we're not going to be negative about anything. We're going to do everything in our power to make you well.
What I love about working here at Aurora BayCare is that we all work together as a team while giving great patient care.
Orthopedic medicine and the Sports Medicine Center provide both prevention and treatment. Medical teams achieved many firsts in care, including minimally invasive and arthroscopic surgeries for knees and hips. Sports medicine brings physicians, therapists, trainers, and fitness specialists to patients.
All the tools you need to succeed are here, and you have personal trainers on site giving you the tools that you need to succeed.
Our grand opening was in the wake of the 9/11 disaster. Area residents were assured the new hospital was designed with trauma services ready to meet any emergency, thanks to the leadership of founding physician Dr. James Bernard. He led efforts to create our Level 2 Trauma Center, and we are the first hospital in the nation verified as an Emergency Center of Excellence. In November of 2005, Doug Dvorak helped an accident victim on I-43 when he was hit head-on at 50 miles per hour, leaving him near death.
Just as I came around the corner and saw the accident, I knew this was going to be something bigger. I made a phone call to Lisa in the ER, asked her to open up the trauma rooms.
I remember opening up the back of the ambulance and seeing him in there and being in the trauma bay and holding his hand and knowing that he would be okay because he was squeezing my hand.
Any place else I would have gone, they would have had to amputate the leg, they would have had to amputate the arm. Because I had top-class surgeons, top-class doctors. They made it work. I still have my leg. I still have my arm. Aurora, once again, has taught me how to build a foundation to rebuild everything I needed.
Look at what we have accomplished. Aurora BayCare was the first hospital in Wisconsin to use digital mammography, the first in Green Bay to use an electronic ICU monitor 24/7, the first to use radio-guided imagery, the first to do a webcast of surgery, and so many more. The unique design of the hospital and the mission of patient-centered care has attracted a skilled workforce of more than 2,000 strong, not including physicians. Professionals are recruited from across the Midwest.
You know, physicians that have an ownership interest in the hospital feel differently about the enterprise. It's personal. When something doesn't work well, they personally feel obligated to fix it.
I've definitely been able to grow throughout the years so that I can, get all the opportunities that I need to be a good nurse for my patients. So I really can't thank Aurora BayCare enough for the support and believing in me all these years.
Aurora BayCare is a great company to work for. They really care about your health and wellness, and actually, this is one of the first companies I worked for that we go out and make it readily available for the caregivers. We've seen a lot of lifestyle changes here, so it's great to be a part of.
We are the only hospital in the region that pays taxes and are the largest taxpayer in the county. Annually, we contribute more than $4 million to the city of Green Bay, money used for essential support services and infrastructure.
We've brought a large number of really good jobs into the market, and as a result, that's really helped boost the housing industry, helps the local vendors, helps the local restaurants, helps the local small businessman. In addition, the hospital purchases a lot of services from local vendors, and so that also helps the local economy to a great degree.
Aurora BayCare has also helped patients facing financial hardships. In our first full year of operation, we provided $3.8 million of charity care. In 2010, the figure was $5.8 million in unreimbursed care. What was revolutionary a decade ago is only getting started. This is just the beginning. Future expansion is already underway and more groundbreaking programs are planned. We will receive our first group of medical students in a partnership with the University of Wisconsin Medical School. Medical research is planned for the hospital, and plans are underway for a medical entrepreneurial program to innovate and invent medical technology. At Aurora BayCare, our walls can talk, and here's what they say.
I think what makes Aurora BayCare Medical Center great are all the dedicated frontline caregivers and physicians.
Aurora BayCare Medical Center is different from any other place because when you walk through the door, the atmosphere is very positive.
Every day I come to work and I work with the best people on earth. I get to work with Lisa and all of our wonderful physicians.
The quality of care that is provided to the patients and some of the new technologies and specialists that we've been able to bring into the market to improve the quality of care that the local residents receive.
There isn't another hospital in all of Green Bay that I can even compare to Aurora.
It's a wonderful place to be. I just love working at Aurora. It's a great place to work at, and it's a lot of fun.
The people have driven this project forward in a way that has been a pleasure to be involved with.
Thank you. Thank you for everything you've done for me. You've made life for me that's possible to achieve new goals. Those doctors were always there for me.